Hello, this is Dr. Gil Wilshire at Missouri Fertility. Today we're demonstrating vaginal ultrasound. Vaginal sonography was pioneered about 30 or 40 years ago, and it revolutionized female health care. If you look at the top of this image, there's a black semicircle on the top. Will you point to it, Amanda, at the very top? That is the tip of the vaginal probe. The tip of the probe has a transducer which emits ultrasound waves that go out into the body, and they come back and bounce back, and the tip also is a receiver, and that allows us to get images. Right here we are now looking at our patient's uterus. Will you show us the uterus, Amanda? The uterus is a pear-shaped organ. This patient has a beautiful uterus. The cervix is on the right. And will you pan through the uterus now, Amanda? And the inside of the uterus, the endometrium, shows up as a stripe. Will you show the stripe to us, Amanda, with your finger? Right there on the inside is the stripe. This patient is fairly early in her cycle. It's fairly nondescript. This is basically a normal uterus. Notice our patient is comfortable. She's in absolutely no pain. Now we'll go out to the side and we will look at one of her ovaries. Amanda, will you show us this nice lady's ovary? Right here, that oval there is her left ovary, and you'll see some little black circles in this ovary. We're getting a little closer. Those are what I call little baby eggs. Those are little tiny eggs that are waking up. Eggs wake up every day, and the more we see, the more activity, the more eggs, the more this woman has what's called good ovarian reserve. Let's go to the other ovary now, please. So we're going back through. There's the uterus again. And here is her right ovary. A nice, healthy, happy ovary, lots of little eggs. And once again, you can see our patient is absolutely in no pain, is very comfortable. So this is a typical vaginal sonogram. Virtually every woman who comes for fertility treatment will have a scan, probably many of them. You can see they're painless, very easy to do. There's no damaging radiation, and she'll be back on her feet in about 2 seconds. We got lots of information this way. It's very accurate, which allows us to make very accurate, intelligent treatment decisions. So there's a vaginal ultrasound in real time. This is Dr. Wilshire at Missouri Fertility in Columbia, Missouri.